Hello, my name is Nercy Sullivan and I'm a patient with PKD. Today we are gathering here with Dr. Priya Deshpande to talk about how to have a successful interaction with your doctor. I am a patient and I've been watching for years how my family and my community has struggled getting an understanding of having a successful conversation with the doctor. So today, Dr. Priya and I are going to have an interaction to show how to have a successful communication with your doctor and leaving the interaction knowing that you got all your answers. Good morning, Dr. Priya.
Good morning.
So today I'm visiting you because I want to know what is going on with my health. How is my condition progressing? I am a patient with PKD, but today I want to know how can we acknowledge what's going on? Where is my health at this stage?
It's great to see you today, Nercy. Thank you so much for coming. So there are a couple of ways that we can assess the way that your health is. The first most important thing is that we look at your vital signs and we look at where your blood pressure is at, where your weight is at. Those are two very important measures about making sure that the kidney condition is controlled. The blood pressure shows if it's high or low. That may indicate that there could be some progression with the chronic kidney disease, or if you're retaining fluid and your weight is going up, we have to watch for that as well. In addition to looking at your vital signs, we look at your blood work. So typically when you come to see me, we end up having lab work done because I need to see where your lab work is today. And the lab work that we typically look at are your basic metabolic or comprehensive metabolic panel, which includes your blood urea nitrogen, your creatinine level, as well as your electrolytes. So those are the three big ones that we look at. When it comes to looking at your kidney function, we look at a measurement called the creatinine, which we translate into the GFR, which is the glomerular filtration rate, essentially a percentage of where your kidney function is. So that's a very, very important number for us to know what stage of chronic kidney disease you fall in, and whether or not there's been some progression with the chronic kidney disease, meaning that is it staying stable? Is it going higher? Is it going lower? So that's going to look at your overall percentage of kidney function. After that, we look at your electrolytes, which is mainly your potassium level, your phosphorus level, the acid-base balance in the body. So we look at all of those as your lab work to assess that the kidneys are doing their job and they're able to maintain the electrolytes, allowing for a good balance with all of these parameters. We also look at your level of anemia. What a lot of kidney patients do become anemic, so we have to make sure that the iron levels within the body, the hemoglobin within the body is all stable. And we have strategies to treat that if we need to. Lastly, what we look at is your bone health. And the kidneys do a lot in addition to taking care of your body cleansing and fluid maintenance. They also take care of your bones. So we have to make sure that levels like your vitamin D level, your parathyroid level, and your phosphorus are all under control. So,
got it. So based on my blood work today, you are going to make those assessments, but you're not getting those results right now. So are we going to base my treatment going forward on my previous blood work, or is that an assessment that you will do combining both?
Sure, usually I combine it both. I like to look at, patients who have advanced kidney disease are seeing me very regularly, almost once a month. And depending on their level of their kidney disease, we do labs either monthly or even every 2 weeks, every 3 weeks. So I do look at the trajectory of the kidney function, and there are certain treatments that we can do right now without knowing your lab work. For example, if your blood pressure is high or if you have swelling in the legs, I can prescribe a diuretic, and the diuretic can affect some of your blood work, but what's more important is for me to treat your symptoms right now. If your blood pressure is fine and there's no evidence of swelling or anything like that, then yes, we can hold off on adjusting medications until I get your lab work back. So it is a bit of a case-by-case scenario, and we always give our patients a call, especially with their lab test results, to make sure that things are in line where they have to be, or whether or not we have to change something.
Got it. And when you make an adjustment on the medication, when do we revisit? Am I taking this for life? Am I taking this for the next 3 months, 6 months? What is the expectation?
Sure, that's a great question. There's so typically whenever I make a medication adjustment, especially if it's for blood pressure, for example, or to treat a specific symptom, I do like to follow up with my patients within a month, maybe 2 months, depending on how critical the adjustment is, or how intense the adjustment is. I do want to make sure that we are meeting the blood pressure targets. So for example, if we have to increase a medication for blood pressure control, I usually maintain that medication as their new dose. So that's going to be their next lifelong dose kind of for the foreseeable future. If a patient, for example, comes into me and they have swelling in their legs, and I give them a higher dose of the diuretic medication, on our follow-up visit, if their legs are looking better and they don't have as much retention, we can always cut it back. So I think it really is a case-by-case kind of adjustment. The same thing with anemia management. For example, if we have to give iron to a patient, or we have to give the injections called EPO shots to the patients for anemia, we tend to look at the lab work kind of prospectively and just monitor things very carefully to make sure that we're meeting the targets, not overshooting the target, not undershooting it. So we want to make sure. So it is a bit of a some medications will be more of a lifelong basis. Some of them will be maybe kind of like a burst of medication just to get a symptom under control, and then we cut back.
Speaking of medication, that's one of the things that I'm also very concerned, because sometimes, for example, my parents used to take medication and they didn't speak English. So sometimes a medication that was just temporarily, they will be taking it for a very long time if we go unsupervised. So how do you manage that to make sure that a patient continues taking the medication not longer than is needed?
Absolutely, that's a great question. I think it's also really hard nowadays, especially since a lot of patients, because of the way that healthcare is now, a lot of patients get their care from different places. So sometimes we don't even know exactly what patients are taking. So first thing, when I have a patient come to me, and I tell them this every visit, please bring in all of your medications. Just bring them in, bring the bottles. I need to know exactly what you're putting into your body, because my list says something different and you're taking something different. So that's the first and foremost thing. And then based on that, we can decide what medications you need for how long, and to help prevent you from being on something for too long. And that's happened to me just recently, where I realized that a patient was taking vitamin D for months and months and months, and the level was really high. So it's a patient that came to me from another doctor, and I was like, why are you taking so much vitamin D? And the patient didn't even realize. Ultimately, by bringing in your medications to your doctor, we know exactly what you're taking. We know then how your blood test results reflect the medications that you're on and the dose that you're on. So I think to help with preventing that lifelong medications and not knowing why you're taking what you're taking, I think bringing everything in is the best option.
Wonderful.